Hi, Andy Biggs here from Arizona's 5th Congressional District. Thanks for joining us today. I've got a special guest with me today, Aaron Ginn, who is the co-founder of Lincoln Network, the largest network of liberty-oriented technologists in the United States. He is now CEO of Deployed, utilizing technology to advance freedom. Hurrah. He spent 10 years in Silicon Valley building technology companies, and he is Forbes 30 under 30 for public policy. He wrote an article titled Evidence Over Hysteria COVID-19, which received more than 3 million views in 24 hours, was one of the first pieces to argue for policy moderation and focus on evidence. Since then, Wall Street Journal has written about him. I've read his piece. I've read what Wall Street Journal had to say about him. And this guy, first of all, I will just say, Aaron, that piece was extremely well written. You took very complex subjects and you broke them down. It's not easy for a lot of people to understand statistics, but you took statistical data and information and made it very conversant. You took language from experts and you incorporated that in, and you drew some conclusions, which I think were absolutely reasonable conclusions. And looking back at them, looks like you were 100% correct, and yet you got censored. So let's tell us about the writing of the piece, the censorship, and your thoughts on why you wrote the piece.
Yeah, I wrote the piece because there was a lot of fear going around in my friend network, and my background is like my family immigrated from China, and so I keep up with Chinese politics and keep up with like the news going in China, and like taught myself Chinese and have visited China many times and did missions over there as well. So,
You're a fluent Chinese speaker, right, Aaron?
Pardon?
You're a fluent Chinese speaker as well.
Fluent now. I would still say conversational. I don't get to practice it a lot in Denver, where I am right now, or in Texas. So, I took it in college, self-taught, studied Chinese philosophy, Chinese history as well. It's all very sort of interesting to me based on my ethnic background. And I was tracking the virus in late January and early February, especially since it was like in the news and also impacted such a large part of the country. And I was actually in the Middle East when the lockdown started happening. I was in Saudi Arabia. I got one of the first visitor visas to go to Saudi Arabia. And I was, sort of shocked at sort of what was going on because, I was concerned about it, but I did not envision that we would be taking basically a policy approach that was pitched by China that we didn't have any evidence for, and that all of a sudden the entire Western world was adopting. Because in the academic circles around in February, most of the discussions among Western academics was not going to follow the same strategy as Wuhan and Hubei province, but we did. And that was really amazing to me because I did not see any evidence or justification for pursuing that path. And the second was that the consequences of that severe mitigation were going to be massive and much larger than anything we ever thought. And that we were hyper-focused only on one thing, and that policymakers were not actually paying attention to you're trying to manage $1 trillion country, 330 million Americans. You can't just overly simplistically apply this one thing across the entire population. So the data that I actually was gathering and putting together was just basically through lots of email conversations I had with friends that were in Silicon Valley, and a couple of them also in academia that were doctors as well. And they encouraged me as I was building out the data to actually post about it and write it in the Medium. Because those doctors and those academics were already lockdown skeptics, in early March. And there were a lot of them. And a lot of the ones you hear today that are lockdown skeptics were back then also lockdown skeptics. But because of the fear and hysteria, which is pseudoscience and anti-science, was pushing them to not speak. So I intentionally titled it the way I did so that it could open the Overton window for us to actually have an honest policy conversation about what was going on and what we were deciding to do. In terms of the actual predictions, 100% is too generous. It's not accurate enough. We're all going to be wrong and right about lots of things on this. I would say the overall disposition was definitely very accurate. But there are definitely certain things we still don't fully understand. Like as gives you one example was the asymptomatic spread. We do not fully understand that. I mean, there was a study that just came out yesterday showing that asymptomatics do not have a significantly measurable antibody response. And other studies have shown that they do. Other studies show that they are infectious. Other ones say that they don't. So it's kind of like all over the place. But what people need to have context then is like even the example of asymptomatics, there's actually a debate about asymptomatic spread as it relates to the flu and other viruses, because this is like actually quite common, so you could say character trait is the way some people respond to coronaviruses. So like there was a lot of lack of context, which is what I was trying to do. And then for asymptomatic, that's like one area I was trying to highlight, that when you put it in context, it's easier to understand how to actually go forward in policy, but also understand your own individual risk assessment. I would say that probably one of the most fundamental arguments I was making was that one is that you cannot take a policy approach from a different country and apply it into a free society, especially from a non-free to free society. Like it always was going to fail because we are a free society. The second was that we are not adequately accounting for different levels of risk assessment. That, as I argued in the piece in March, that children were obviously not at high risk, and sure there were, we had less data than we did back in March. We had less data than we do now. I mean, now we have over 20 countries that have opened and have had no evidence of sort of super spread or massive spread event outside of a case in France, which French government eventually disclosed, saying that it was all happened before they actually reopened schools, and one in Israel, which is actually in a high school that they're still investigating. But I mean, my main argument was actually in primary school. But either way, like that was an example of how that we were having a sort of a catch-all single approach to a group of population, a group of Americans that will have massive impacts in their life for the next 60 or 70 years of their life, when they statistically are far more likely to be hospitalized or die of influenza. And we never approach this same way. And actually the CDC condemns, like resoundingly condemns this sort of large approach for influenza outbreaks at schools. So this inconsistency in terms of policy approach showed me that this was actually not driven by evidence, and the people that were speaking evidence were actually being shut down, and that this was being motivated by a sort of a senseless a fear of what was being driven by the media that was coming out of Lombardy and that was coming out of Wuhan. That if you understand, even just talk to even a pro lockdown epidemiologist, they would tell you that we are only measuring the most severe events. Right. We have a sampling bias. We have an initial measurement bias that we need to alleviate to actually understand the full effect of the virus, and we were not pursuing that. And then throw in the policy consequences of lockdown, which if the lockdown was not based on evidence to begin with, it will not be alleviated based on evidence either. Yeah. And that would have massive $1 trillion of impact on hundreds of millions of lives, that would put us into a recession, hopefully not depression, and would be far worse than anything that this virus was ever going to do to us.
So three quick points, Aaron, that come to mind. Number one is I'm going to try to dovetail to what you said. So we had Dr. Fauci crafting policy, and what you just said is so important, because Dr. Fauci himself has admitted multiple times he wasn't looking at anything other than a very narrow, kind of a myopic view of what was his job to do, which was try to prevent coronavirus spread. On the other hand, he didn't take into, and he admitted he didn't take into account any societal or economic implications, and quite frankly, any other public health ramifications as well. So that just dovetails perfectly with what you just said. And the second thing is I've been doing interviews of doctors for some time now, and epidemiologists and others who have written about this. And I have actually had some tell me that they would not let me interview them because they were afraid of the backlash that they would get by appearing with a congressman who's asking questions about data and science, which I thought was intriguing.
Yeah.
Because I said, look, I don't care. You could be the most, I'm very conservative, but you could be the most liberal person in the world. You're talking about data and science, and I just want you to explain the data and science to us in a way that people can understand it. And he said, I can't do it because the backlash will be too great. And that's kind of getting at where we go, because you saw all these things early on. You wrote about them. And what was the reaction after you posted?
I think it's various. There's a silent majority, right? That, like, I agree with you that the lockdowns are not anti-lockdown views. Let's just say that. There's wide varying reviews about, sort of the severity and success of COVID that we're actively pursuing. But from a lockdown policy perspective, it was actually very bipartisan. Like, lots of people were very skeptical of lockdowns. In fact, a lot of the professors I work with, I know are Democrats and actually are very liberal, and some of them would, want Bernie or, Biden to win, right? But they saw the fact of, like, this is like a disaster. This is like, it fundamentally also will help. It only biases towards those that have the luxury to do Zoom calls and to shelter in place. And that a lot of those people knew that this was not going to work out well for those that are most vulnerable. And those that are impoverished in our society, let alone that was going to happen in Africa, which is we're talking about like almost millions of lives there now, based upon the new estimates coming out of the WHO, which is why now the WHO has been saying, oh yeah, Sweden, actually that's probably working out better, right? You could tell in terms of like how this is dovetailing out in terms of as we're leaving lockdowns as a nation and as the world is. It shouldn't seem to you like ironic, right? That all of these countries decide to sort of leave at the same time, right? It's not like the virus has stopped necessarily in those countries. It's because from a narrative and from a mimetic perspective, we have all we got into it because we were all feeding off bad mimesis off of news stories, right? And as in, well, that country's locking down, that country's locking down, that country's locking down, right? So therefore, we're going to lock down, and then once they realize, oh crap, this is like really bad, right? Then all of a sudden they just all left it, right? Because it wasn't really based on an actual like evidence-based argument. And the data that we're actually getting from the like, you could say the FOIA like requests that were going on in Europe, both in Denmark, as we've seen from Denmark, Norway, and the UK, now it's coming out of Israel as well, is that it ends up being that lockdown policy was being driven from a political motivation. It was not actually being driven by a lot of the actual, you could say, public health officials. Right. They were actually being, you could say, more or less say, forced to agreeing to do something that they originally did not. And the evidence we have is like in early March, a lot of those same scientists were saying, no, we're not going to do a lockdown because like we believe our public health system can accommodate, like we're still investigating, et cetera, et cetera. We want to be cautious here. But instead that caution turned into the inverse, right? Where if you don't do anything or do like the most extreme thing, you're not being cautious, right? So the UK is having an inquiry. I strongly suspect that Denmark will also do one as well. There's probably going to be one in Israel. I would not be surprised if we do that here, seeing like how did we end up in this place where there was, like as you said, like a lot of scientists who say that, what are we doing? This is not actually based on science, or like, the evidence doesn't show that. But yet there was silence. They were pushed out. They were called names, and we, sort of killed the greatest economic boom we've ever had as a nation through a media-driven hysteria. So that what's going on in Europe will happen here. I don't also want to throw the baby out of the bathwater. Like this, like scientists say things, science doesn't say things, right? So like we need to understand that like that what was being argued should have been presented with more caution and should have been presented with more, you could say, asterisks. However, as you said, that like it's ultimately up to the policymaker to make the decision, right? And like with Dr. Fauci, you're 100% right. Like he had a job, that was his job, right? And his job was to, this is my only thing I work on, right? Just as I don't expect someone from Treasury to give me a bunch of pitches about how to help HHS, right? like we all have to, as you are a policymaker, we have to be balancing competing interests. And for some reason, this, for this in early March, we decided that there was only one thing to worry about. And that was going to lead to, as we've seen today, 40 million Americans unemployed, 1/4 of African Americans, workers unemployed. We have millions and millions of kids that have missed probably going to miss an entire school year. Let alone like all of the, you could say graduating seniors, like how many of those kids are not going to get scholarships now because they didn't finish the season, right? How many people who work at, like going on the sports thing, how many people who work at NHL or MLB, like what are they going to do for a job? Because they're like, they're not going to have in-person fans. Like the downstream effects are so massive that you can't just stop like the velocity of society, right? You can't predict what's going to happen next. And I separating also what like we're going on in terms of like all of these protests, they're undoubtedly connected to the pain, the psychological pain, and the economic pain that we're all going through. Like you can't divide that as a instigator or a spark, right? To the cause of the lockdown.
Right. Yeah. So just a couple of comments, because I mean, and that's why I like talking to you, man. You were just covering in a holistic way what's going on. So just a couple of things. When you talked about the riots and the social unrest that we have today and how it may or may not be connected, think of this, that the Census Bureau put out a census questionnaire. Over 48,000 responded. Embedded in that census were the 4 questions that are diagnostically used to determine whether someone's clinically depressed. Over a third of Americans that responded are clinically depressed, and it's related to the lockdown. So you have that going on. Then you have this tremendous an aspect that you didn't cover that I think has got to be talked about, and that is we have a structural deficit at the federal level of spending. When we had the best economy in certainly at least 100 years, we still had $1 trillion structural deficit before the virus relief packages hit. So what's happened is we have added essentially $4.5 trillion in structural deficit for this fiscal year alone, and that's if we don't spend any more money. So add that to your national debt of over $23 trillion. Then you start saying, well, how does that impact long-term economic growth and development? When you have over 40, you got about roughly 42 to 45 million people unemployed, because those are the real numbers, because we fudged the U6. You have a food supply chain that's in jeopardy, where we've euthanized literally millions of chickens, poultry, pork, and now looking at beef. And you're seeing prices escalate. So that means restaurants are going to continue to be stressed. Whether you're low income or middle income, you're going to be stressed by the cost of higher food prices. All of that goes into the ramifications, the cascading impacts of the decision to basically utterly lock down and take an economy that somehow we were able to stop within about 3 days' time. And now I don't know how you build that V up again and have growth in your economy again, because we've actually contracted by at least 5% as well.
So this was always like my fears, that like I have a strong background in economics, is that I'm humble enough to know that this is an infinitely more complex system than you can put into your infectious disease model. Right. And that you have to step back and be like, just as I like using this example, I mean, how many times have we met somebody, became friends with them, and realized that they were friends with somebody that we were friends with and had no idea, right? That shows you how complex our society is, and the fact of like, how do you even, like Governor Whitmer still doesn't allow hair salons. Like, how does she know that like one hair salon is different from another hair salon, or this hair salon? Like, you don't, because that's like what makes free society so amazing, is that people can come together, recreate something and make it different, and then sell that good or service.
Right.
and being to like abstract into creating this like list of things that are banned and not banned is just like an obtuse form of logic. It's just crazy. Like, I mean, I think Governor Wolf's like, I think 1,000 business list was like one of the worst things I've ever seen, because it's like that means like somebody in the government was sitting there going through, oh, yes, no, yes, no, yes, no,
Yeah.
like as if like that person who is probably some random policy 20 something like that went to some, you maybe University of Pennsylvania, somehow gets to decide the future of like a person who's like been doing, let's say, having a restaurant for 30 years. Like that person like gets to decide just randomly, like who wins and who loses. Like there was no humility at all in this lockdown analysis. Then you add in
Yeah.
like the nosocomial aspects of this. Like, we know that like probably up to 50% of all of fatalities occur in like a common location, which is nursing homes. So
Right.
like you remove that now from like the overall risk assessment of the general population. Then you add in like known T cell immunity that we now know. We know there's some innate built-in immunity. We know there's some background immunity. Like, throw in all these other things, and yet it's like the science has accelerated way thanks to a massive amount of pre-published, or you could say pre-peer-reviewed research. We now fairly certain about a lot of things in terms of the broader susceptible population. This is in the science has accelerated, but the narrative is still stuck as if we're still in March, I guess 16th or 20th, somewhere around there. Like, we're still stuck there, right?
Yeah.
Uh, and then again is like models are one thing. I mean, I would say models are useful looking back and understanding different factors that contributed to understanding, let's say, our understanding of a certain decision. Models going forward as a projection, especially infectious disease models, or as Dr. John Lee says, are utterly rubbish, right? So like leaving that aside, like if you actually go look at data coming out of our allies in Europe, right? China's data is not believable. Like, if you go look at actually their data, right? Germany and Iceland and UK and Sweden and Norway, and why are we still having even this conversation around lockdowns? Like why is Governor Whitmer, right? And I'm picking on her, like, because she had her recent press conference about reopening. So she says, I'm still investigating hair salons. What do you have to investigate? Like, Europe reopened, right? It's been reopened for a month. Like, what else? What unique thing do you think that they don't, right? Or the other 30 states that allow like you to get a haircut. So like, what do you think is so unique about your situation that you get like I have to go investigate something? What specific? I don't even know. Like do you think you have some like special hair salon situation in Michigan?
Yeah. It's crazy.
However, I mean, she is encouraging people to basically cut hair without an occupational licensing, and I'm opposed to most occupational licensing. So like, that's great. So I'm actually okay with that. But yeah,
Well, yeah. She's Aaron. She's created perverse incentives. A black
yeah.
market. When you forbid this kind of otherwise legitimate business conduct, you create a black market system. So that's one thing. But okay, so we've covered a lot, everything from science, economics, etc. We haven't talked about. We got two things we got to talk about before we run out of time. Number one is
Sure.
constitutional rights, the rights of individuals that have been abrogated, and how do we get those back? How do you look at getting them back when you basically, like Governor Whitmer and virtually every other governor in the state, very few didn't do this, where they said, you're of value, we're going to respect your right to have your own business and to associate. You may be a big box retailer, but we're going to discriminate against the mom and pop shop over there that sells 10 sofas a month instead of 100 sofas a month.
Mm-hmm.
How do you get those rights back when they've been abrogated and you've maybe altered your infrastructure just a little bit in some ways?
Yeah, I have one of my group academics I read a lot is Joe Cockton, who writes a lot about this thing called this new feudalism that exists in so you could say broader corporatism America, and a lot of the lockdowns, as you suggest, sort of continue to feed that narrative, right? That like, why does a big box allow to be open, but me, who has a more creative form of that business because I'm trying to compete against the big box, is not allowed to open, right? and that like how that from a you could say American spirit perspective is not what we signed up for as a nation, right? It's like not our values. And I'm not a constitutional lawyer in terms of like actually suing on behalf of the government. I would argue that the reason why we're here in terms of states that still lock down is because lawyers or judges have not stepped up, even though we know from from the actual statutes perspective that we have grossly allowed the executives in these states to exceed their power. And I mean, because like they're in an area zone in terms of policy that is very unknown, right? I remember one person from the Justice Department I talked to very early on. I was like, "How's this constitutional?" And she says, "Well, we don't really know exactly, right?" So like, yeah, because it was kind of an uncertain area. But like, from leaving aside the evidence around COVID, from a political philosophy perspective, I'm very much in favor of reforming our shelter-in-place laws. As what was, I think, pitched in, I don't know where it went exactly, but in the Ohio legislature, they passed 15 days you can allow for a shelter in place, but after that has to be approved by legislators, the committee of legislators. Like my sort of political philosophy is that legislators, Congress, et cetera, should have the most power in a state, because that is why Congress has more enumerated powers than the executive branch. And that for some reason in the last sort of 50 or 60 years, we've sort of drifted away from that. And this is what has led to this situation. But many of these states, I don't understand how it is justified that you can just arbitrarily make these rules. I mean, leaving aside the evidence is not there to even support that. But even from like a rights perspective, like we've never done this. Like even from a 1918 perspective, which is the closest thing you can get to it, this did not happen. Like, and I think St. Louis was one of the most firm cities, against cities too, which are different than statewide. Cities, like kids still went to school, businesses were still open, public transit still worked, people still went to work, right? There was not this like massive quarantining of healthy people as a means of mitigation, and from a like attaining our rights, I would think back, I would say they've never been lost. We just gave it up to fulfill the precautionary principle, which is not how our legal system or an American system is created. So then you go add in, I think the other areas in terms of rights that people miss is that the reason why our society is so successful and is one of the greatest societies ever to come across the world or humanity is because liberties is associated with healthy humans, right? Being able to, like you said, like being locked up in your home mentally affects you to where you are depressed, which therefore you will make bad decisions, right? Versus being free and being open and feeling like you have agency, feeling like you have the ability to go to church or go hang out with friends, like, which is like people don't realize is a very unique thing in human society.
Yeah.
And this is why we're so prosperous. I mean, like that you can like eat at McDonald's and Taco Bell, but yet still live till 75 or 80. Right? Like these are things that we are like luxuries that we've created because we are free people. So freedom is not just like you have the ability to say, as you said, say things or like sort of, that's a very simplistic way of understanding freedom. Like the liberty allows for humans to truly flourish and to be more human, to be more creative, to be more who they are and who like I believe God created them to be.
Yeah, to fulfill the measure of their creation. That's the way I like to put it. I mean, you're created to be that way. Yeah. So we talk about that, and I do like the way you pointed this out because I always talk about this. It isn't that they took our rights away; they were trying to take our rights away, the executives, but we acquiesced in that. That's the thing that always blew my mind is how
that's what actually happened. Yeah,
yeah, we acquiesced. So the last thing is we got to get in this before you go is you posted your article about hysteria. I think it was like March 2nd, something like that. On social,
it's like March 16th or March 18th. It's like it was mid-March.
Okay, so middle of March on social media, you had millions of views within 24 hours. This thing was going big, and it was going to be a real game changer, quite frankly. The question is, what happened? I mean, somebody took it down. You want to continue?
Yeah, I mean it did. It changed. Like I know that the White House read it. I know a number of governor offices did. it did change. Like it changed the conversation. I think it opened the Overton window. And then you had other people that follow on to me, like Thomas Friedman and Dr. Katz on the New York Times, and then Dr. Levitt came out on Monday, and then we had Dr. Ben Hadid and Bhattacharya at Stanford on Wednesday. So like it started a wave of so we could say open dialogue about this issue, which was sort of the main thing I wanted to happen, and which is why like I didn't really get involved in terms of the public debate after that, because I knew, as you knew, all the physicians and all the academics who are lockdown skeptics. Like we just needed to open the door for them to speak, and actually for us to debate this as a society that is impacting 330 million Americans. I'm sorry, we're a democracy. 10 infectious disease experts do not get to rule the nation. Like that's just not the way it works. Like we are a democracy that will debate things, let alone like it violates our Constitution, which is, I believe Congress has this power. I do not believe that, again, random people in the bureaucracy that we don't know, who are unelected, who are not accountable, like do not deserve to have like this sort of like level of like absolute authority, right? Which again, I agree with you that we just sort of gave them. Like it wasn't like the law didn't change, we just sort of just allowed it, right? But in terms of like the platforming issue, it's my belief that platforms have the right to associate with anyone they want to. And Section 230 allows for moderation. I don't know why people don't believe it does. It actually does. It was written to actually support moderation. But whether or not whether or not they should have done it is a different question. You could say from a moral or from a health of society perspective. Obviously, that there are a lot of these platforms behave in ways that were basically hating on science, and that they actually were pushing an agenda, but were not self-aware enough to know that they were doing that. So I don't agree with that approach, saying that those ideas are radical. That's just labeling. It's not accurate. The debate about whether or not platforms should be able to moderate, I do believe platforms should have the ability to moderate. If they didn't, Facebook would be full of violence and all the worst things of the internet. So like we should allow, like, if you want to have a community of only dog owners, right? A social network of dog owners, and a cat shows up owner, right? The dog owner community should be allowed to say, you can't be on my platform, right? So I know there's like a debate going on. I think Holly is leading it, or somebody is leading it.
We'll save the bulk of that debate for another time, Aaron. I mean,
so that's my opinion on that.
Yeah, no, and it's a fair opinion. I think that a lot of people like you and I agree with that. I'm struggling what to do, and like I said, I think there's a real broader question on that. But be that as it may, getting back to it, they took you down, but the story had already been seen, and it really did lay the groundwork for some of the doctors, because I mean the list of doctors you just named, and including others, Erickson and Ioannidis and these guys.
and Wiskowski and there's been a lot. There's like Dr. Offutt, there's Dr. Altwater, like there's a ton now. Like,
there's a ton, but it kind of opened the window to allow at least another a voice to be heard, which I was actually asked that question early on when I said, there's problem. I said, this is not, first of all, I don't know that we ever make policy by a bureaucrat. And second of all, I'm not sure that there's a consensus on this. And second, and thirdly, they said, what do you think should happen? I said, well, the president should probably assemble people across the spectrum who can come in and debate the facts and the science and give advice. That's their job, is to give counsel and advice. But
yes, absolutely.
So Aaron, I think we're about out of time, but man, you've been great. And you've done a great work, and I really appreciate it. And I hope we get to talk again. Looks like we might get to talk again on maybe big tech and platforms. And
that's true. That's my background. So
self-censorship or something like that. So stay in touch, and God bless you, and thanks for the good work that you do and what you did to really make a difference in this country. Thank you.
Yeah. Thanks, Congressman. Thank you.